Dr. David Gutterman, Dr. Jenna Mendelson, both here talking about your mental health wellness. All right, Dr. Mendelson, at what point should we as parents know that our kids maybe need to talk to someone?
Children can be a little slower to open up about their emotional experiences. Sometimes they're not even necessarily aware that what they're experiencing is an emotional experience. So some signs to look out for can be if your child isn't enjoying things that they used to really like to do, if they're reluctant to go to school or to go do things during the day, if they're complaining of stomach troubles, that can be a sign of anxiety. If they're sleeping a lot or sleeping not enough, either one of those can be a sign of something going on emotionally. And certainly if your child does open up to you about something that's going on with them, you don't have to wait to the point of a crisis to seek out therapy. That can always be a good option.
So Dr. Gutterman, let's talk about this because we've had several questions about referring them to low-cost counseling services or where do I start for counseling services, that kind of thing. What can you tell us about that?
Well, first and foremost, it is vitally important to know that services are available across the board for children, for adults, in-person counseling, as well as virtual counseling. So there are lots of resources available. There's a 24-hour helpline at 832-9700. That's the area code 336 for a 24-hour a day help. Cone outpatient behavioral health services at 336-832-9800 is a good number to call for outpatient services. And LeBauer Behavioral Medicine, where we are providing virtual counseling. So just like we're doing talking virtually right now, you can meet with counselors. In addition, there are Guilford County Behavioral Health Center has walk-in clinics. And so I believe you have a graphic to show folks as well that you can call any of these numbers and reach out and get help. They will be available for you, and it's important not to delay. All the things that Dr. Mendelson just mentioned with regard to children, there are adult versions of all of those symptoms, and sometimes even adults, we're not really aware that what we're experiencing is an emotional issue. But if it becomes somewhat chronic and disruptive to your life, there's help out there.
This person is saying, how do we deal with less socializing? We're so used to staying at home and away from people and trying to stay safe. So how do we maybe get back into that again? Or how do we deal with just not having that socialization?
That's a tricky one. I think just trying to start where you are and taking small steps towards maybe the kind of social life that you used to have. If there's something that seems manageable or that is related to interests that you have, like an online book club, for example, if you've gotten used to socializing online, there are book clubs that are available online that could be a step towards getting a little bit more social.
This person,
go ahead.
I'm
sorry, go ahead. It's a good question because I think gradually, as Dr. Mendelson was saying, gradually working your way back in. But for many people, they've gotten not used to not being around other people, and so it seems unusual to think about. But we have to kind of get used to that again, especially with regard to who's being careful and who's not being careful, because that's the other issue too. A lot of people who have young children who are not vaccinated are much more reluctant. I, as a grandparent, very reluctant to be around people unless I really have a good understanding of what their vaccination histories are and that sort of thing. We have to be very mindful of that all these factors play into how comfortable we are being around other people.
All right, very quickly, if we can I still feel sad on my antidepressant?
Well, yes, you can. It's not the antidepressants are exceptionally helpful under the right conditions. That doesn't mean you're still not going to have some of the normal experiences of sadness from time to time, but that doesn't mean they're not effective and they're not helpful.
All right. Well, thank you so much both for your time and your expertise. We so appreciate it. And we do have those help numbers for you. They're going to be in the your well-being section as well as the 2 Wants to Know section. We want to make sure that you have all the resources that you need.